Rather, we will be going live on Harvard University Facebook page as well. So our students will be attending from the Facebook live. The
Okay.
link that we have shared is only for the members, like that is for you. We have
Sir,
invited Hemal sir on your behalf as well.
Okay.
Ahmed, the PU webinar conductor, Dr. Rajesh Acharya and team, and
Okay.
myself. Rest all the students will be attending it through PU live webinar through Facebook.
All right.
Uh,
sir, please begin. We are live.
yes. Very good morning to one and all. Harvard University, on behalf of College of Physiotherapy, I, Dr. Dharman Vyas, welcome you all to today's webinar. Today we have our guest speaker, Dr. P. Ratan Kumar. He has done his Masters in Musculoskeletal Sports. He is currently pursuing his PhD. He is working as an assistant professor at Ashok and Rita Patil Institute of Physiotherapy, Charusat, Changla. Sir has a vast experience of clinical as well as academic experience. Sir is into this field of academics since almost more than 15 years. Sir has published more than 20 papers in international as well as national journals. He has been guest speakers, invitee, chief guest, as well as a judge for various academic conferences and seminars. Sir has conducted several seminars, webinars around the globe as well as in India on various topics. I feel immensely proud to invite and welcome Dr. Ratan sir to Parul Institute of Physiotherapy as a guest speaker for today's webinar. Sir, on behalf of Parul Institute of Physiotherapy, Parul University, I welcome you and thank you very much for accepting our invitation to be a guest speaker for today.
Uh, Good morning, everyone. First of all, I'd like to thank Dr. Daman for such a nice introduction. Thank you for saying lots of things about me, which may not be so, good enough as me. Okay. Uh, Quickly, we'll move on to today's topic. That is understanding functioning issues. So this may be a little bit new for some of the listener, but it may not be a new for many of us. But anyhow, let us try to go inside. Today, I'll be covering why does we assess any patients or any health situation. We'll also see about use of health definition in the assessment. Then, what is functioning and why it is important to us, and how to understand functioning, and documentation of functioning, and linking with the management strategies. So these are the content I'll be covering in today's session. Why do we assess? So many of us assess the patient for different reasons. For documentation, especially this may be required for the IPD setups where we everything we need to document. Right? Another reason in the OPD, mostly in the OPD setup, we maybe assess the patient for diagnosis purpose who are coming to us for the first time or who is referred by someone else, right? But the most important thing is for understanding the health problem, right? Not only the documentation, not only the diagnosis. We also should assess the patient to understand their health problem. For this, we have our traditional method of assessment, soft format, which does not allow us to, think much, but only to, go on the documentation step by steps. And recently, we have another clinical algorithm, HawkTool. This is something new. This is specially designed for a clinician. And this allowed us to think, and a patient-centric assessment is allowed in this particular format. So let us see what is HAWK, hypothesis-oriented algorithm for clinician. This may not be applicable for IPD setup, but this is designed truly for OPD setup. So it is more or less similar to these components are more or less similar to our traditional assessment method. I'll be relating what are the similarity also, and what are the difference and what are the improvisation, those area also I'll be, relating time to time. So collect initial data. So when I say collect initial data in our traditional format, you may say this as a patient profile. So which may contain their age and the height, weight, and so on. Right. So this is more or less similar to the our patient profile. Once you get a patient profile, we'll get generate patient identified problem. Patient identified problems. This is something we used to call as a symptom, which will be the problems which are reported by the patient. Okay, this we are interested only in the functional issues, not in the other aspect, right? So there may patient may say is that I cannot climb, I cannot walk, I cannot run, okay, I cannot go for cross leg sittings. These are the things patients will be reported to us. Okay, so once we get the list, based on the list, right? So just for easy understanding, let us give the example of cannot able to unable to climb the stairs, right? So, for example, for OA population, for them, unable to climb the stairs is one of the most common problems. So, based on this problem reported by the patient, we will formulate examination strategies only and only to understand unable to climb the stairs, not assessing the OA as a whole. Okay. So, for formulating examination strategies, we will be requiring some hypothesis, right? Hypothesis in the sense why he or she is not able to climb. So maybe because of pain, or maybe because of malalignment of the joint, or maybe because of laxity, muscle weakness, fear of fall, so on. Many more reasons might be there. So we have to put or plan some hypotheses. Based on that, we'll formulate the examination strategies, and based on that, we'll start conducting the examination. Right. So now just say if I'm putting a hypothesis that because of muscle weakness or joint range restriction, so I'll be examining muscle strength assessment for quadricep, hip extensors, or some other muscle which I'm putting as a hypothesis, and also I'll be examining range of motion for tibiofemoral joints or ankle joints or even for hip joint, which are involved in climbing. Right. So once we conduct the examination, then we'll go for analyzing of those findings of examination. Right. So based on the finding, we'll be refining our hypothesis. Okay. So now we have already kept two hypotheses, for example. So out of that, strength is not a problem. Range is the problem. Then we'll focus more, refined hypothesis related to the range alone. Then, based on that, you may carry out additional examination if it is needed to confirm or deny the hypothesis which we have already started in the beginning. Okay. So, based similarly for every individual, problems reported by the patient, we'll be conducting examination strategies based on the hypothesis which we generated from those problems. Okay. After finishing the examination, we will be getting another list of problems, which we used to call here as a non-patient identified problems. Right. This you can also relate as a sign, which we found out in the process of assessment, which is not reported by the patient. Right. So patient does not report to us that I have only quadricep muscle 2 or grade 2 or grade 3, but they say that I cannot climb. Right. I cannot climb is a symptom, but what we found as a grade 2 or grade 3, this is what we found after the clinical examination or assessment. So those things we will be putting under patient non-identified problems. Okay. So, generate a hypothesis as why this problem exists. Now, we have got two different type of problem, patient-identified problem and patient non-identified problem. Okay, merge these two problem, I mean, list of problem together, and again try to put up some rationale or hypothesis why this problem exists. If the patient is saying the truth thing, which is also related with the clinical finding, or patient is lying, and we have different finding in the clinical, testing. So this too has to be rationalized. So after this process, if needed, you can send for referral service or consultation to any other profession also. So after merging these two, patient identified and non-patient identified problems, we'll be refining the list of problems. Okay. So some of the problems may be beyond the scope of physio practice that has to be identified and sent it to referral service. Let's just say it is grade 4 OA, for an example. Here, the role of physio is very minimal. Only the pre-operative sessions will be there. We cannot resolve the fused joint or collapse menisci. So here we have to compulsorily refer to the surgeon who can take care of those problems. Okay. Apart from that, as a pre-op, we can think of strengthening the muscles, which can help in post-op care. Right. So that way, we need to refine the problems as and when required. The referral service has to be provided because the rehabilitation has to be always a teamwork, not a one man show. And for each problem, estimate one or more goals. Right. So just say we found that unable to climb the stairs, it was because of muscle, quadriceps muscle weakness, hip extensor weakness, plus decrease in the range, plus pain in the knee joint. So this was a three, rationale we are putting up. Because of this, the person is not able to climb. So to solve the climbing problem, we can have more than one goal. We'll try to strengthen the quadriceps and hip extensors, and we'll try to improve the range of tibiofemoral, and we'll also try to reduce the pain in the joint. So after improving or after solving this one, the patient problem, what they have come to us, that has to be resolved. Okay, if it is not resolving, the whole process we have to do once again to refine the problems for testing related and hypothesis and other things, we have to repeat once again. So at the end, this whole process is patient centric and not the way how we do in the traditional way, like documenting everything and putting a generalized protocol. Okay, it will be very specific to the problem reported by the patient. So this is all about a hope. Use of health definition. This is very interesting to all of us. We have very famous definition of health given by WHO. Uh, it states that health is a complete state of physical, mental, and social well-being, and not merely absence of disease or infirmity. Right. So here they have included three major components to define the health. First one is physical, mental, and social. Right. The problem is, are we using this definition properly during our assessment? I don't think so. We are generally in our traditional assessment mostly focus on physical component. Very minimal, it covered the mental area, and very rarely or almost negligible area it covers for the social component. Okay, it means we are not using the definition of health properly for assessment purpose. So when you are not using the all component which is given in the definition of the health, it will be like incomplete assessment or incomplete understanding of the patient. Right. So when you have incomplete understanding, I'm very much sure that your management strategies also will be incomplete. So collecting information about the health, right? So we are not collecting everything about the mental, social, and physical. We are collecting only for a physical component. Or for assessment also, we assess mostly for a physical component. And even planning the management strategies also, we plan mostly for physical component, leaving aside the mental and social component. So no one actually used this definition. So we need a more defined notion of health, which can be covered up by every therapist or every healthcare professional, so that it can look the health issue or functioning in a proper way. So need to focus on what matters about one's health. Health is about how we function in our day-to-day life, right? It is not about the improvement of the range or improvement of the strength alone. It is about how the person execute, how the person perform themselves in the real life. That is about health. So based on this, WHO come up with another terminology. Apart from the definition, they come up with another terminology, that is functioning. So functioning is a term given by the WHO, which will be upon the definition of the health. It says that it is a set of specific domain of human functioning, right? So it's a not only one particular joint or one particular muscles or ligament. It's overall about human functioning, about body function and body structure. This is two component. And another interesting one is the things people do, right? So being a farmer, they'll be going to the farm. Being a teacher, they'll be going to the college. Or being a parent, they'll be helping the kids and other things. This is a thing people do, and things people aspire to do, right? So if I'm okay with my knee, I want to go to Statue of Unity, because climbing lots and walking a lot, right? So what people desire to do and what people are doing, these are in fact nothing explained as a functioning. So increasing only the muscle strength or range does not fulfill all the area. And functioning talks about it's a more function or less function. Now let us come back to the same example of climbing. The person cannot climb or person can climb. So that way it will define the functioning, right? So partially able to climb or completely disabled, this is something mixed up. So functioning will be simply defined as a more or less, more functioning, less functioning. So importance of functioning, we should we should notion of functioning matter. Why should notion of functioning matters to the health profession? Why we should care about this terminology? Okay, it is it is why mattered by the patient. Patient patient think only about symptoms, not about the sign. Right. I want to climb the stairs. Okay, that is the only thing what they matter about. Okay, but they don't bother about I need to improve my muscle strength or I need to increase the range of motion or so on. That is not the concern from the patient perspective. Patient concern is I want to climb the stairs or I want to walk, I want to stand for a longer duration. That is what matters to the patient. Okay, direct outcome of health intervention, right? So it is not, we will not be talking about the muscle strength, we'll be talking about whether you can climb or whether you cannot climb, right? After our intervention, it will be dealing only about, oh, initially you were not able to climb, now you can able to climb. So that way we'll be dealing, not dealing into, or initially range was 90-degree, now is 70-degree or 110-degree or 120-degree, not dealing in that way. Straight away we'll be dealing with direct outcome of the health intervention, like initially I cannot climb, now I can climb after the intervention. Okay, healthcare policies, it is not much practice in India, but in the western population, much most of the health policies they uh, covered or they consider the functioning. Based on the functioning, in India we used to have a disability certification, but in the other countries, western countries, they use the functioning profiling. Based on the functioning profiling, their policies and health policies and other things can be dealt with. So when we try to understand the functioning, uh, we always require three major components: biological component, social component, and psychological component. So biological component we are already dealing with, and the social component is something which we need to add on. Psychological component also some partially we are dealing with, but we need to strengthen to those areas. Uh, in 2001, WHO come up with a new health model. Before this model, we were having medical model. So in the medical model, it believes that any limitation in the function or restriction in the participation, it is because of failure of the structure. So let us come back to the example of ankle sprain. So lateral ankle sprain, so twisting or sprain to the lateral ligament, it is the main cause of not able to uh, go to the school or go to the participation area. Right. But this biopsychosocial model, it gives us a different way of understanding. Now I'll come back with the same example of ankle sprain. Uh, Let us just say, for easy example, a student has a grade 2 ankle sprain and their classroom is in the ground floor. First example. And second example, another student has the same grade 2 ankle sprain, and their classroom is in the third floor. So I don't think these two students will have same difficulty in attending the class. Obviously, the second example student whose classroom is in the third floor, he will have more difficulty reaching up to the class and attending to the class because of he has to climb the stairs. So this climbing component, it's nothing but comes under environmental factors, which explains under contextual factors. So here, the grade or severity of the ligament sprain does not, change the amount of disability. It is because of the environment which is changing the amount of disability for these two examples. Right. Another example, if for this two ankle sprain patient, if the ice cream parlor is just 10 meter walk from the place. So the person may not be so much having difficulty reaching up to the ice cream parlor. But if the ice cream parlor is in the 1 kilometer away or 500 meters, right? Walking up to 500 meters, walking up to 1 kilometer will give more difficulty, right? So reaching up to the ice cream parlor, an amount of disability is based on the distance, right? Not only on the severity of the ankle sprain, right? So that is why environmental factors or else the contextual factors plays a major role, right? And even the personal factors. I I know that I have ankle sprain. If I want to try out to walk up to 500 meters, sometime I may be able to walk. But if at all, if I don't want to try out, then simply I will not be going even for 10 meters also. So there also comes another contribution from the personal factors, whether how much disability they have or not, right? So using this model, we have completely turned over uh, in the understanding of the health of an individual. It is not only about the structure, what we used to deal in the earlier, it is also involved from the contextual factors which play a major role in deciding the amount of disability of the individual. So let us see some of the example. Body function, body function, yeah. So body function, it talks about how much impairment does the person have. Okay, so how much impairment? So this will talk about the physiological function of the system and including psychological function, right? So let us give the same example for ankle sprain. So in the right side of the screen, you can see the qualifiers. So using the qualifiers, zero, no impairment, mild impairment, moderate, severe, and complete impairment. So you can give grading for that impairment. Okay, and if it is not specified to that area, you can say not specified and not applicable. Okay, so that way we can uh, using the biopsychosocial and ICF, we can, quantify the amount of impairment. So I have used for ligament sprain. Apart from that, lots of other examples are there, like mental functions and pain functions and sensory and pain functions, neuromuscular and movement-related functions. Many more items, components are there. So for every component, we will be using the same qualifiers. Okay. Another one is body structure. How much impairment does the person have in anatomical part of the body, such as organs? It may be organs, or it may be a limb, or it may be other component of the body, right? So, example, it may be structure of nervous system, or structures of cardiovascular, or immunological, or respiratory systems, or structure related to the movement, maybe muscles, joints, and ligaments, and so on. Right. So here also we'll be using the same qualifiers 0 to 4 for giving the severity, and 8 and 9 for applicable or specific component. Coming to the activity and participation, how much difficulty does the person have in? Okay, in executing the task or activity in the actual life situation. So here we will be dealing with two different additional components, performance and capacity. I'll come back to the example of stair climbing, right? So the person is able to climb the stairs, or any individual is able to climb the stairs using the railing, right? So performance would be somewhere around mild, moderate, okay, because he can complete the task. But on the other side, capacity. So he is using the railing. Without using the railing, his difficulty or his activity level will be more challenging. So that way, you can, in the capacity, it may be severe or complete difficult. So without the railing, he cannot climb. It means it will be a complete difficulty. But using the railing, he can climb. Then performance can be of mild or no difficulty. So that way, it give more precise, not only able to record the activity or not, it give more precise understanding about the activity and participation. Some example domains here I'm mentioning is learning and applying knowledge, mobility, self-care, then domestic life, community, social, and civic life. So these are some examples I'm mentioning. Another and the last component, which is most important, is environmental factors. It talks about how much of facilitator or barrier does the person experience. Right here, it involves some judgment. Some examples may be considered as a barrier and some may be considered as a facilitator. So I'll try to clarify this one. A person after, heart attack, after hospitalization, the person come back to the home, right? So the family members serve or help the ill person in every activity, like giving a glass of water, giving a medicine, and giving a food or breakfast. Everything is served to the person. So when any visitors comes to the house, and when they look these all services to the heart attack individual, the visitors will think that the family members are very helpful. They are facilitated to this individual. Okay. But if the same visitors come back after a 6 month, after 1 year, okay, and still the same serving is going on, the visitor's comment will change. Oh, even after 1 year of heart attack, he is not able to do himself. He is not able to take the glass of water by himself. Everything he has to rely on the family members. The visitor's comment is changing, right? In the initial visits, he was happy. He was uprising to the family members that they are good, they are facilitator, right? But here, my understanding is different. So in the beginning weeks, the family members were not the facilitators, they were the barriers. Because of their extra cares or extra services, the person's participation in the actual life, like getting up and taking a glass of water, taking the medicine by himself. He was about to start, he was supposed to start, but because of extra care from the family members, he did not start. So, in the beginning itself, those activity or care given by the family members that become barrier for his recovery, right? So this is one of the example. Lots many examples are there, which we, being a therapist, also we need to realize and understand. Even this also need to educate to the patient family members, patient parties, right? So giving extra cares will limit their participation. So if the person, even after after the MI or heart attack, if the stent is applied, everything is perfect from the structure component. But the cardiologist says that don't do this, don't do that, don't go there, don't travel, right? If he is not participating in his real life, then he is not still functioning, even after putting those stent or that medical procedure, right? So when we will call that particular person functioning after finishing the medical procedure, if he is able to perform his own activity in the real life, then only we'll call the person as a functioning. Unless we will not call the individual as a functioning, still he has restriction, he has barrier, right? So the whole concept is putting the person into fully functioning. So here I have some documentation of functioning. So normally use of ICF browser, so this will help us to link the complaint given by the patient with the ICF component. And we also have some already uh, developed ICF courses for 12 chronic conditions. So if your condition falls under the same area, you can easily pick up those courses. Otherwise, you can use the ICF browser. So let me show you some of the some example of browser. Right, so I have already opened this one. So this is ICF browser. So all four component what we have discussed earlier, it is already here. Body function, activity and participation, environmental factors, and body structure. So if you are not familiar with the browsers or ICF codes, what you can easily do is just say walking. So patient says that yeah, we were using climbing. So you can just type climbing in the search search area, right? So climbing can be linked under D4. So D4 comes under mobility, right? And under the mobility, you can also see the D4 double five moving around, right? D4 double five. So it comes under the 455 moving around, right? It can be linked under moving around also. And it also has got another one, D4551. D455, yeah, we have exactly climbing, right? So if you use this coding D4551, which is a common language worldwide, right? If you mention this coding in the assessment or somewhere, any corner in the world, they will realize, okay, D4551 is climbing. The patient has a climbing problem. Okay, so this way, if you are not familiar with the coding, you can use a search engine, search option, and you can link with the problems what they have reported. Another one, already I have mentioned that already some of the courses has been developed. So normally what you can do is, I'll start the process once again. In the Google, you can just simply type ICA, sorry, you can simply type ICF courses. Okay, so once you type the code set, the first one itself, right, the page what I was opening earlier. So go to this button and start selection. So these are the list of courses we have. Okay, these are the list of courses we have for musculoskeletal, for the cardiovascular, the neurological condition, and for other. Right, many are there. Right. So if you are whichever condition you are, okay, you want to. So this is again every course set has got two types: brief and the comprehensive. Brief is recommended to use for single professional, like physio alone we are assessing, and comprehensive is recommended to use by multi-profession, like med physician and surgeon, physios, and so on. When we use a multi-professional, the comprehensives are recommended. But it is not restricted that a single professional cannot use the comprehensive. If you want, you can use it. Excuse me. So let us say for back pain. So select the comprehensive for back pain, then submit selection. So again, the list of item which is included in the course set will be highlighted here. Okay. Yeah. So finally, create documentation form, right? So this is the documentation form which is generated online. It can be printed or it can be saved as a PDF also. Here, every individual in the initial you can type the patient details also X, Y, Z, whatever it may be. Okay, patient details you can information you can type in here. Right. And these informations can be taken from the case history, patient reported questionnaires. We have multiple questionnaires, condition specific. From that also you can take some information, clinical examination or technical investigation from any of the area or combination of any area can be used for documentation. Right. So this way you can go through the whole component, and I have already mentioned about the qualifiers. Using the qualifiers you can select or you can give the scoring. Okay, so once we finish the scoring, we'll be having uh, yeah, just a minute. Yeah, so this is about documentation. Okay, so this documentation, like using the browsers for beginners who does not know about the coding, and if you already have a common conditions under the list of ICF courses, you can pick up any courses as per your uh, requirement. Next one, linking with the management strategies. Right. Whatever problems we have identified, or what are the problems we have identified under the functioning, those things need to be linked with the management strategies so that we can solve those problems. Right. So once we complete the documentation, next step would be creating functioning profile. Right. So I'll come back to the web page once again. So once we finish this filling up, the last we will get create functioning profiling. I have not selected anything, so it will come everything as a blank. Okay, but I have one example, sample example, which I can show it to you. Yeah, so this is the documentation for one patient who has a coccydynia. Okay, age, genders. So this was the information which we have stored earlier. Okay. So based on our documentation, the cross mark areas are the area which we have tick mark. After that, we have created functioning profiling, okay, which is generated from the documentation itself. So after looking at the profiling, we realized that in the every individual component, like in the body structure, body function, body structure, or activity and participation, which are the area she has problem. Okay. Now, based on this profiling, we need to plan our management strategies. Right. So, if anything is not there in the profiling, it means you might have missed out in the documentation. So, no problem. You can go back and uh, do the profiling once again and create the functioning profile. Okay. So once you get the profiling, then this from the profiling you have to link these issues which you have documented with the management strategies, right? And like I have discussed earlier in the hawk also, for one particular issues or problems, you can have more than one goals to solve or uh, to resolve that issue. Okay, so this is all about understanding the functioning and how we can document it. And these are the reference which I have used. And thanks for listening. So if anyone has any query, you can ask me now.
Thank you, Ratan sir.
Yeah.
Bhavna ma'am, thank you so much, Ratan sir, for this really good uh, webinar. The thing is that we do not understand the functioning, actually the functioning issues when we talk of practical aspects of the patients. And we just blindly go in for the treatment. Our main motto comes pain relief, improve the range of motion, but we do not look into this issue which we actually thought it should be looked at from the point of view of patients. So this is really, I hope that all the students and other physiotherapists who have been seeing this webinar understand that what is the importance of an overall assessment or overall understanding of the patient's problems, where actually the patients are facing issues. I would like Mohammed to give the vote of thanks for today.
So, really very informative and very detailed, even though it is a simple word to assess functionally, because this is always the scenario with the students. They just take the functional evaluation at the end of their assessment just to fulfill the need of their academic requirement. Otherwise, it is not being correlated or implemented properly for patients rehabilitation. So thank you so much for the detailed insight about the functional evaluation and its correlation. And we are really grateful to you by sparing your valuable time and knowledge to our students and others also. Thank you, sir.
Thank you, madam.
Thank you, Ratan sir. Thank you so much.
Yeah.
Bye, sir.
Bye.